with anticipation to having a 16-centimeter detector to provide us very good cardiac and cerebral imaging, as well as being able to utilize a wider helical beam width to enable us to do faster imaging of the cardiovascular system.
Really integrated it into our trauma protocol to be able to scan from head to thigh within a couple seconds without having to re-scout the patient. Just helps that flow.
That was one of the driving force why we chose Revolution CT.
Cardiac seems to be what we specialize in. We do everything from the non-con head CTs to standard abdomen pelvises, but really the shining point is, well, every other scanner can do that, but what really shines with the GE Revolution is the fact that we can acquire these coronary studies. In fact, with TAVRs, some part of the process is doing the TAVR protocol, then they go to intervention to get a cath. Sometimes by doing the TAVR protocol with the Revolution, we're actually getting a diagnostic coronary study as a side effect or a byproduct, thus making it so that they don't have to go to IR and have that second procedure. Again, reducing time on the table and cost and patient satisfaction and patient comfort, lowering risk.
影像诊断的发展离不开先进的技术 ，Revolution CT 具有更高的成像能力和水平，帮助我们解决了临床遇到的实际问题，优化了检查流程，提高了检查成功率和安全性。
They can see initially if there's a bleed in the head, as well as 2 seconds later you can see that the liver is bleeding as well. You used to take a couple minutes in between the scans, so it helps benefit the patient very much.
The installation of the Revolution CT was a very important development in our department. So the new technology, both the hardware and the software, gave us the possibility to develop new algorithms in emergency and trauma radiology. We could work with new CT protocols. We were able to introduce protocols that include multiphasic CT imaging in a very short time. And it also allowed us to do a more comprehensive and a better imaging quality, at the same time reducing the overall radiation dosage. Then for us at the Karolinska University Hospital, together with the Karolinska Institute, it also gave us the possibility to start new research projects.
In fact, this is the first set of images that we look at to find all the lesions, especially small lesions below 15 millimeters.
If we have patients that are uncooperative or unstable, you need to get them in, you need to get them out. You can scan ahead in one rotation in 1 second. So even if it's somebody who can't hold still because they have tremors or they have altered mental status, or it's a child, you can scan them, you're done.
Patient flow, speed, the fact that we don't have to spend that much time with the patients, getting the patients in and out in less than 10 minutes. I think that's just been amazing.
It's so quiet. And that's a really key factor for coronary imaging, because when that thing ramps up to that speed, the patients get nervous with the noise, and you just watch the heart rate jumps up. So
that nervousness is gone.
Yeah. Favorite piece is the prospective exam split, because there's a lot of times where we end up working by ourselves. We have 3 scanners. We constantly have people in our scanners, so we might have to separate. Go to work the Revolution by yourself. You scan, grab your exam split, scan the patient, go get the patient off the table. When you come back, everything is to the PAC station in the appropriate file. You don't have to wait and send. It really speeds things up.
We did some planning for leaseholds to improve the patient workflow portion of it. And the fact that when the patient's done with the scans, they're kind of surprised that they're done that quickly. But for us, from a technology standpoint, the fact that whether we have a patient, a regular cardiac patient or an AFib patient, our success rates have been phenomenal, especially with the option of being able to capture the heart on the second rotation with auto gating. It's been a phenomenal success rate for us. First and foremost, I think that when we thought about making a decision on purchasing the Revolution CT, we really thought about the whole experience. So one of the first things we did is we understood the engineering. So the engineering of the CT was pretty phenomenal. That was a great basis to build everything around. More importantly, as the study is becoming much more consistent and successful.
Now with the cardiac applications and the acquisitions, because of the fact that now we're acquiring images with a 20 gauge needle instead of an 18 gauge needle, which is patient safety, the costs are cheaper. We're using less contrast, the spatial and temporal resolutions are far superior, and it's almost a thing of the past of heart rate management. So we no longer have to risk patients' well-being by trying to bring down a heart rate.
Again, it's the ease of use and the fact that I don't have to click on it so often. I really don't have to deal with it that much. You know, it's nice, easy, smooth from one side to the other and back. It's just become more, so much more friendlier. I think that's made my life easier too. I don't have to. What I have to think about is the next patient, not this one. What to do, what to click, and open this, close that. I don't have to do that anymore.
As I said, we have an improved detection of the smaller oncologic lesions in the body, especially also in the liver. And yet again, I'm trying to use it also to predict if a patient will respond well or not on certain antitumoral treatment.
We have got a better image reconstruction algorithm, so we could lower our exposition dose for some acquisition protocols.
Revolution CT 正如它的名字一样，带来了心脏 CT 检查技术的重要突破。无论是高心率、心律不齐，还是房颤患者，均能够在一个心动周期内成像。即使个别不能配合摒弃的患者，也能够完成检查，检查成功率很高。 辐射剂量也较低，大部分患者在1毫西弗以内，图像质量也令人满意。
Being able to acquire those studies easily and efficiently. I mean, you know, especially with neuro.
They actually could get a lung CT and a bone mineral density study at the same time.
So with our institution is a stroke center, trauma center. We do a lot of vascular work, and so there's a very important component of the imaging that is done with CT, and the availability to do very fast imaging and having the capability to have no motion for the patient is a great asset.
The ease of the interface. The interface works really well with these types of exams, because when you're looking at the interface, you can see all of your parameters in your collections, and you can see your task bar where all of your series are laid out. So you can basically look at your entire program just at a glance, which is huge.
Using the scanner as it's so automated, and I felt like I've just basically have given myself to the scanner. So go ahead and take care of everything. I'll just stand back and watch, and that's been quite amazing.
It's a beautiful interface. It's visually stunning.
The new UIs makes production much more capable. Also, we've changed a few things in terms of patient intake. So we've improved our patient workflows by almost 100%. Some of the AFib patients we've done since with the Revolution CT has been almost 100%. So for the patient's sake, as well as for our ability to read the patient studies, it's been a phenomenal improvement.
Once you select your protocol or protocols, because you can actually prospectively select multiple protocols, and you can actually go through and set them up in the beginning, so you can pretty much, it's almost like a fire and forget, where you set up all of the studies or all of the reconstructions all prospectively. Then you actually conduct the exam, and then you can immediately see to the needs of the patient, while in the background, all of the reconstructions and reformats are processing automatically.
It's made my life much easier.
Those adjustments that you can make on the fly are great, and you have a choice of what you can do. I can change my rotation, I can change the MA, I can change the KV. So they're shocked, well, I'm done already? I'm done. Yeah, you're done.
Yeah, that's the response you almost always hear. We're done? Yeah, we're done. For me, it has revolutionized my way of scanning. So I think that's a perfect name for the scanner. Whoever picked it.
Patients are more comfortable, they're more calm, we get good pictures the first time, and it reduces the times that they have to actually return to get extra imaging.
We can look to the Revolution scanner as being able to provide superior image quality in all areas of imaging. And in our practice, oncologic imaging is very important. Our contrast volumes will be less, and the reason for that is that we can cover a greater area in a shorter amount of time.
I think it's been phenomenal for the primary reason that we're able to get consistent studies. The first area that we're able to measure is actually the time it takes for a patient to be taken through the intake process and when they actually leave. So we've been able to reduce that almost 100%. The other piece of it is post-processing has been improved by almost 200%.
It's just had better credentialing for us, as it were, as a cardiovascular imaging system, and also for oncologic imaging. I think those two areas have benefited. The investment for me as a clinical radiologist is how well we actually improve our clinical service. And that really has benefited from having this system, as I mentioned, for cardiac and vascular, and also for oncologic. I think our clinicians appreciate the fact that they're getting better studies, and that really means that we're rewarded in a clinical sense. CT imaging is really, it's a major part of a radiology department. Things have evolved, as everybody knows, over the past 20, 30, and 40 years. And this is just really elevating the performance of CT scanning to what's technically achievable.
以前觉得做心脏检查是很复杂的事情，我们现在用 Revolution 这款机器做心脏检查是一个很简单的事情。我们一次检查当中呢，可以完成多器官的一个联合扫描，比如说心脏和头颈血管、心脏和腹部器官，甚至于心脏和全身的血管。另外呢，我们用 Revolution 这款机器一次检查可以完成功能和解剖信息的获取，比如说肝脏的血管和肝脏的灌注。图像的成功率有保障，图像的质量和辐射剂量也令人满意。
包括 Revolution 这些设备出现，现在剂量已经下来了。所以呢，当然这种剂量设备再好，还是在你用。所以我们怎么通过我们的研究，能够优化这种流程，能把病人的剂量降到最低，这样就是可能对病人给病人带来更多的益处。
Well, since we've had the Revolution CT at our site, it has increased our patient throughput. So it has helped us provide more cardiac CTs in a single time point. It has also helped us establish a more robust service with more diagnostic quality images. It has helped us develop an acute chest pain service where patients can just walk in without any pre-preparation for their cardiac CT, with the confidence that we can still get diagnostic images on all of them. And it has helped us improve our image quality so that our clinical referring teams, the cardiologists, have more confidence in the technique.
For us, it gives us new verticals. We're predominantly cardiac, but the neural opportunities are pretty phenomenal.
So the future of CT, I would say, in the area of neuroradiology, I think is going to be to get better and better images. Now CTA is already, I think, better than MRA as far as getting a nice spatial resolution. So now we need to push the system to the speed of the light, if I would say. So
the future of CT imaging is one which is going to grow and continue to grow. I think we've been very fortunate to have CT used for the past 30 or 40 years in an incrementally increasing fashion, and I see that really continuing with the Revolution scanner. So we're really glad that we have the Revolution scanner, and we anticipate that it's going to even get better.